So let's talk about sex. How much of your practice for menopause is around sexual function and changes in sexual function, whether it's hormonal, whether it's anatomic, physiologic, and those kinds of things?
Yeah, I see a whole lot of people for sexual function, and that's partly because of my menopause practice, but also partly because of my pelvic pain practice. So some of the people that I'm seeing, are 19 with sexual function issues, but definitely, I'm seeing a lot more people who are coming in that kind of perimenopause, menopause with pain with sex, with lack of interest in sex, with dryness, discomfort, tearing, genitourinary syndrome of menopause, lichen sclerosis, pelvic floor dysfunction, kind of all of the above. So we have to kind of capture all of those issues. And I never want to do too many things for somebody at once, but generally it's like multiple different issues that we're working on. So we're going to, give them something for the lack of estrogen in the vagina. We're going to work on their pelvic floor if they have that issue. We're going to treat the lichen sclerosis if they have that issue. Generally, I'll start with those things first before I start doing things to treat libido overall, because if somebody's having pain with sex, of course, they don't want to have sex. So that's like a given. So we'll work on those issues. And then if we're still having an issue, then I start to address the libido side of things a little bit more.
Is testosterone it for libido? What are our options? Because like you said, I think if it's pain in general, we have some options, like you said, whether it's just vaginal dryness and atrophy, lichen sclerosis, which is, you can see and treat, or musculoskeletal causes of pelvic pain and dyspareunia. But if they're not having those things and it's truly just libido, what are options? Because I do feel like I'm just letting people down every day when they say my libido's gone down. And I'm like, sorry. I would love to give them more information.
Yeah, so there are options out there. And again, it is one of those sort of multifaceted approaches. And there are a lot of changes that are happening in life at that time too. So we have to kind of deal with all of that. Like I said, sometimes it's like you don't like your partner. Sometimes it's like you're running around between your job and your kids and your elderly parents that you're caring for and your PTA meetings, and you just like sex is the last thing on your mind. Like, so people are so busy right now. Sometimes it's just that your body's changed and what you like's changed and you haven't really taken the time to explore that. And sometimes it is really just like a hormonal issue. Usually not. Usually it's like a multiple issue. So yes, testosterone is one of the things, but I have a great sex therapist. It's on my podcast. It's local that I have people work with. I really like the Rosie app. I don't know if you're familiar with that. This is a great place to refer your patients. So it's an app. It was developed by an OBGYN, Dr. Harper. You should have her on. She's out of Texas. And, she was having trouble with the sexual issues that her patients were coming to. And she created this app where they have everything from like erotica at like different levels of steaminess that people can handle to sex coaches and like anonymous group therapy. And they have like all of these different levels of ways that you can kind of address libido and information. So I'd like to refer people to the Rosie app. There are some supplements out there with some limited evidence. Typically, I don't know if we can talk about different particular brands, but I like the Hello Bonafide brand for a lot of their supplements because they have things like Reverie, which is hyaluronic acid for the vagina. They have some supplements for menopause, and they have one called Restella for libido, which, for some people it doesn't work. And for some people, they tell me it's life-changing. So it's a little bit like of a, see what works for them. And then there are the kind of newer non-hormonal things that are out there. So there's Addyi, which is the sort of oral medication that, people will call like the female Viagra. It's not female Viagra, but it is something that can improve interest and can improve sort of the sexual experience in general. Just like anything else, it's not perfect for everybody. I've had some patients who haven't gotten much improvement from it, some that do. The data I find is not super compelling, like, one increased sex episode a month, but I think it's also a little bit of how they have to measure that. So, it's really hard to measure your interest in sex or your sexual satisfaction. So just one episode a month sure might be like a big deal for somebody who wasn't having sex before or wasn't having enjoyable sex before. And then there's Bremeline, which is more the injection. I don't use as much of that because I find not many people want to inject themselves an hour before sex. So I don't tend to use a lot of that. But the point is that there are options out there. There are things that you can do. You can at least, refer people to some podcasts or some literature or to the Rosie app so they can start kind of thinking about, okay, what is the issue that I'm really having? Everybody, of course, wants to just pop a pill and like have everything all be better. But that's really not the solution for most people. It's usually kind of communication in their relationship and working on the pain issues and a very sort of multifaceted approach.